Running an ambulatory practice today isn't simple. Leaders are balancing patient care, staffing pressures, financial performance, and rapidly changing technology all at once.
Welcome to In Practice, a podcast focused on the latest in ambulatory care, what works, and what leaders need to know to help their practices thrive.
All right. Hello, everyone. Thank you for joining today's episode of In Practice. I'm Jenna Hagan, VP of Product Marketing here at NextGen, and I'm joined today by Dr. Nord. Thank you for joining us.
Thanks for having me.
Yeah, absolutely. As we kick it off and get started, would you mind just giving a little bit of background of yourself and your practice, where you're located?
Yeah, absolutely. So I'm Dr. Keith Nord. I'm an orthopedic hand surgeon in Jackson, Tennessee, kind of between Memphis and Nashville, and run a busy practice as the managing partner for a small group of orthopedic docs, and primarily see hand, elbow, shoulder patients.
Awesome. Thank you so much. I'm particularly excited about this episode. I might be a little bit biased, but I just love orthopedics, prior physician extender before working for NextGen. And so working in sports medicine on the sideline and then the OR and partnering side by side with the physicians, it's been a great background and experience. So I just love to dig in, and I'm excited to talk to you about how you've been able to drive efficiency in your practice as well.
Yeah, absolutely.
Awesome. Well, before we get into AI and all the things that you've been leveraging with Ambient Assist and the tools, can you take us back to before you started using clinical AI with Ambient Assist and what your practice looked like, just some of the burdens or areas you were looking to improve?
Yeah. So back before I was using AI, basically I was kind of struggling to find that balance between being efficient in clinic and getting all my documentation done, and then also being a small business owner and in a small practice. How do I maximize the amount of time when I'm paying employees to be here? And so what I ended up doing was I basically was just making these little notes on scribbles of piece of paper and fee sheets as I was going through my day seeing patients. And then I'd hit the end of the day and I'd have 1 to 2 hours of just dictation. And we previously were just using a kind of a standard voice to text dictation software where I type things. But I mean, even doing that, if you're seeing 50 patients in a day, just several minutes you spend on a patient can quickly add up. If you just spend 2 minutes on a chart and you see 50 patients in a day, that's 100 minutes of just documentation in a day. And so I'd be sitting there for an hour and a half to 2 hours at the end of each day, just doing dictations and getting paperwork done. And I'd be getting home late to my kids, or it actually got to the point where I started cutting my schedule back at the end of the day so that I'd have time to get done and could get home at a reasonable time. And so that's kind of what it was beforehand.
Yeah, absolutely. And boy, do I remember those days. The charts stacked up even before the EMR of at the end of the day at the desk, and the security blanket of the fee sheet, as we like to call it, where I'd write blue shirt, hat, played lacrosse at so-and-so high school so that we'd have visual cues to sit there after clinic and catch up on those notes. Was there a specific moment where you said, okay, something's got to change. I've got to try a new tool outside of writing on your fee sheet or pieces of paper?
Yeah. It was kind of about that time when I was like, okay, I want to be home for dinner with my kids and not be spending the last 2 hours of my day dictating. So, we actually looked into hiring a scribe and having a person come work with me. And then we started looking at the cost of that and the other struggle of having to train somebody and slow down my clinic even further to train a new person. And then one of the problems I had run into in years past is that you'd spend all this time training a person or a scribe, and then they move on. They go to school or something else or to another job, and bam, you're right back at square one having to train somebody again. And your whole flow gets disrupted because you're relying on somebody else. And that was kind of when I started looking more towards technology. I was like, okay, what other solutions are out there?
Yeah, absolutely. Were you, for your initial reaction when Ambient Assist hit the market, were you a skeptic? Were you curious? Were you like, nope, we're going in. This is absolutely what can help us with the practice?
I was a little skeptical. I had used some things before, and they were a little bit disappointing, and kind of you spend more time reviewing stuff than I feel like it was worth. So going in, I was a little bit skeptical going in.
Yeah, that's understandable. And you still hear about that in the market today, right? There's individuals who say,
sure.
look, I'm a physician. This is how I'm going to practice. I'm not going to change my ways, and this is going to force me to change my workflow. So there's just even a fear of that. Change management is incredibly hard in an organization, as you were kind of mentioning, even just training staff, onboarding staff, and changing workflows and technology. Curious too, how did your patients interact with the change? When you let them know that you're using an ambient scrub? Was there questions? Was there concern? Or were they like, sounds good, and saw no change?
I've really not had any patients that have truly questioned it. Usually I'll just briefly mention like, hey, like my phone is recording to write the note for me so I can just focus on you. And usually when I say that, patients are just like, oh, awesome. Like, they're not, I've to date, I mean, I think it's been over 2 years now, and to date have not had a single patient complain about it or be concerned about it or even ask me to turn it off. And now we just add it to our intake, and it just says on there, like, hey, we use AI listening for documentation. And so really we haven't had any issues as far as patients being concerned, and definitely no like medical legal issues or anything like that.
Yeah, that's awesome. It's been a game-changing tool in the industry just in terms of easy to adopt and change management. Once you kind of get over that curve of concern or skepticism and acknowledging, the efficiency that it can drive. Now, remind me, prior to leveraging an AI tool, when you were in practice, were you documenting on your computer in the exam room with the patient? Were you documenting exam findings with them there or outside of the room? So, some physicians just have that balance of concern of walking through their exam findings right in front of the patient and concern they don't know what it means and that jargon.
I do a little bit of a mix of both. And sometimes even with Ambient, I'll just tell the patient, I'm like, hey, I'm going to speak a lot of doctor speak right now. This is for the note. So if you have questions, we'll go over it. But it's the nice thing with doing it with Ambient Assist is like I can do that in the room just in a second without having to touch anything or do anything. I'm just talking to the patient, and my eyes are always focused on the patient. So it's just kind of 100% attention. And so previously I was doing a mix. Like I would do mainly I would be doing scribbles and small notes on the fee sheet and then going out and doing the documentation afterwards. I know in training in school, a lot of times that most schools nowadays, they teach that the most effective way to do your dictation and documentation is in the room with the patient. And I have found that to be true. I mean, if you do your dictations right then and there, they're more accurate. You're missing less details. Like you're doing it right then and there. The problem is you are slowing down your whole clinic by doing that. It takes you longer to get to the next patient, and then you're paying for all of your staff to sit there while you're dictating. And then the patients feel like you're not paying attention to them. Your eyes are locked into a computer screen, and you're clacking away at a keyboard or talking not to them, but to a dictation thing and looking at your note. Whereas with this, it's just in the background. Like I can just look at the person and talk to the person and treat the person. And then at the end I leave and boom, click a button and note's done 30 seconds later.
Absolutely, especially with how fast AI technology has evolved in the industry, right? The verbal cues, the macros, and the ability to just say, hey, on your exam today, I'm seeing this. And that quick little on exam can blow in that whole macro of that jargon that patients aren't familiar with listening to.
Yeah. One, like just to talk about the macros. So like just literally a couple of weeks ago, we were going through our practice's denial rates for procedures or MRIs or different things, and the two people in our office that utilize Ambient Assist have, by a landslide, the lowest denial rate with insurance companies across the board for insurance, for surgeries, for MRIs. And so our office manager was actually like, why do these two guys have a much lower rate of denials? And it's pretty clear. It's because Ambient Assist is picking up all those details. And when I say, oh, the patient has positive carpal tunnel findings, it puts all the things that the insurance company is looking for to approve a surgery And so the miss rate is very low compared to me actually doing the note later.
Yeah, that's incredible. That's really great to hear. There was an assumption as AI rolled out in the industry a couple years ago, right, that would likely take place. You've got more detailed documentation. You're getting the whole narrative and the history pulled in there, and so you can focus on the patient. But it's really great to hear those outcomes are, coming to fruition. Now, I had the pleasure of interviewing you about a year and a half ago as you got under your feet leveraging the clinical AI tool. And pretty quickly, you said that you were able to see about 5 more patients a day. Mm-hmm. You're wrapping up clinic right around 5 p.m. so you could get home to have dinner with the kids and to all the activities. And so I'm curious, a year and a half later, how those efficiencies are continuing. Are they kind of settling, or have you seen even more expansion as you've gotten familiar with the tools?
Yeah, obviously, as time's gone on, I think that the tools have actually gotten better and more efficient. So I think that's been a huge benefit. One thing I really love is like the suggestions for ICD-10 codes. So like that's been a new development since I think last time we talked. And that's amazing because especially for me, as a hand surgeon, there are so many ICD-10 codes, like per finger, per joint, initial encounter, subsequent encounter, open fracture, closed fracture. And it's kind of almost freaky how close and accurate the Ambient Assist gets to actually getting to the diagnosis code I want. Not only just that, but it'll pick up like I was talking to the patient about their diabetes and their hemoglobin A1C, and it'll auto-suggest that. And so I think that plays into the low denial rate. And also I'm able to bill higher level visits because I'm catching those ICD-10 codes. So as far as efficiency, I think it has gotten more efficient and faster. One, just because I've gotten more used to how am I going to do my physical exam dictation or my little 10-second blurb of reading the x-ray for the diagnostic interpretation. So I think over time it's gotten more efficient. And definitely, that was the big thing I noticed is that I was able to use that hour and a half to 2 hours of time I was just dictating at the end of the day and just add more patients on. And so, it pretty much paid for itself over a very short course of time because I was more efficient and still getting home at 5 o'clock to go pick up my kids from school and eat dinner when I wanted to go.
Yeah, absolutely. That's incredible. And, tying it back again to the denial rates that you called out and the decrease in denial rates, remembering the days and hearing the clients and the challenges in the market of providers quickly picking those pesky unspecified codes because it's right there that defaults majority of the time, and depending on coders or billers or lines of defense or the denials to come back, and then the time and cost to recoup. So that sounds like an incredible efficiency. Really glad to hear that you're leveraging that. Speaking about how quickly AI has evolved and expanded over even just the past year and a half, let alone the past couple of months. I was looking the other day, 72 startup companies for AI have announced and hit the market in the last calendar year. It's incredible. What are you most excited about as it continues to evolve and feature functionality?
I think it's kind of wild just because, even for a human scribe, like if a patient goes off on a tangent and starts talking about their cousin and their injury to their shoulder, and we're talking about their shoulder, things quickly get muddled and mixed up, and notes can get incorrect. And I think with the advances in AI, I've just been shocked at how accurately Ambient Assist is able to pull out those extraneous details that you don't want in your note. And then you just get these very crisp, clear little bullet points that just kind of show you like, hey, this is what it thinks an actual person would want to read. And so it makes the notes more legible. Like, like a lot of times I get these ER consult notes and it's just click data that is absolute nonsense to try to read. And you see one little snippet of what the doctor actually thought at the very end of the note of 7 pages later. So I think it's just amazing. Like it's just reducing the burden of how much stuff doctors have to read through, not just for me, but for like everybody who reads my notes. Like I've actually had consulting providers tell me like, they're like, you have the best notes, like of all the orthopedic docs, which it's not really a high threshold to try to beat an orthopedic doc's notes. Usually it's a bunch of like abbreviations and stuff. But I've been told that by multiple people. Like, you have the best notes. Like, they're so easy to read. And I'm like, yeah, an AI wrote it.
Yeah, that's awesome. That's great to hear. You know, it's interesting as AI rapidly expands, not even just in clinical documentation or in a scribe role, it's expanding throughout the EHR and other feature functionality. What role do you see AI playing beyond its current use of just a scribe functionality and as a provider?
Yeah, I think in the future as it goes forward, I mean, especially as technology and miniaturization kind of kick in, I mean, I could see this in the future being like, like glasses with a camera in it, like your AI glasses, where you're in surgery and it's just watching what's being done, and the up note is dictated for you. I could see it going to that level where I'm just wearing some wearable technology, and my notes are just getting cranked out as I'm moving along doing things, and my administrative burden and documentation burden just gets even lower and lower. I mean, even now, like, it's starting to recommend, oh, you talked about this medication. Can it preload my prescription up there and do that? And same thing with the billing. Like, I can't wait for the day when it says, like, we listened to your exam and you did this and this, and based on Medicare and CMS guidelines, like, we think you should bill level 4, and it's already preloaded for you. Do you agree? Click end encounter, and it's a one click, like, my whole visit is done and bills sent and everything.
Yep. I would imagine those days are probably not too far away with how quick all the feature functionality has expanded, for sure. Now, just as much as you had a little bit of, concern or question about how it would change your workflow, knowing that it would give efficiency, but just wondering, right, the role of AI and how it could help your world. If you were talking to a provider that said, no, like, I'm going to stick with my templates, stick with my, voice to text dictation, what would you say to them to give it one try? What area would you recommend for them to focus on?
I think for the notes for the visits, because it's really not as big of a hurdle as I thought it would be. I mean, it's literally, I go to my schedule, which is nice to see anyway, at a glance on my phone, and then I just click the visit and hit Ambient Assist and start the visit, and I just walk into the room and start talking to the patient. I mean, I can look at the note before and say a couple little things, or look at the x-ray and read my what I think needs to go in the document for the x-ray report. But it just makes it so easy because I'm not carrying a bunch of things around with me. I'm not worried about writing down all these notes right away. Like, it's just, I know it's going on in the background, and then that's what I'd say is the thing to try. Is, like, you have to try using the AI to write your note. I mean, it just is so much more efficient. And now that I know the downstream effects of it too, of like, okay, like, only one thing changed and these two providers are using it and their denial rate is substantially lower than the other docs in the same practice, in the same area, same region, it just becomes a no-brainer, because you can't even really quantify the benefits, because I'm spending less time doing peer-to-peers. Like, it's less time that I'm on the phone, and, like, that's not really quantified or tracked, but, like, if my denial rate is, 60% lower than the next highest doc, it just saves me that much more time on the back end. So that's what I would say to try if you're a skeptic, is try using AI to write your notes. Like, just give it a shot. Like, I mean, if you don't like what it puts out, you can always change it and type it just like you would anyways. And you can use your voice to text to put your own spiel at the end. And sometimes I still do that. I want my own personal thing at the end. But the nice thing is it's all right there, and the majority of the notes there, and I can just tap and in a second use the voice to text and add my own personal thing at the end.
That's exactly right. And one thing that I think has been great that I've seen a lot is the ability to just meet it where the providers are in their workflow, right? The hybrid workflows, you're using it for the majority of your note documentation, but there are providers where they say, okay, I'll get the comprehensive history, the lengthy pieces of it. I mean, thinking back to the patients that are in there telling me their life story for 30 minutes, and being able to capture those meaningful pieces, but then step out and finish the exam or the other pieces how they normally would, if that's their comfort level. You pretty quickly see the change management and the adoption roll in, because they realize how easy it is, but it is flexible and you can plug and play on your workflows.
And I frequently let it keep rolling. So I'll turn it on before I go into the room. And I'm still kind of, I guess, technically doing a hybrid workflow, because I have to interpret my own x-rays as an orthopedic doc. So I'm looking at my x-ray and I just say what I read, and I know it's getting heard in the background. And the nice thing is I don't have to do a separate x-ray interpretation note. It automatically puts it into its own category of just saying this was the X-ray interpretation, and so I'm getting my credit for it without having to do an extra step. And then same thing, I can have it like give me a summary of like the last 3 visits, and I can just quickly read it and say include the summary, or it can pull things from old notes if I want it to. And so it is nice to just be able to do that.
Yeah, that's incredible. And to your point, the time savings of the documentation and the heavy narrative pieces have allowed you as a provider to be enabled to do the other pieces of the workflow, like orders, x-ray dictations, medications, things like that, instead of having those additional support staff that I think providers are fearful to get rid of or feel like they're replacing them. And they're not. They're organizations that are high volume that still need them. But the true replacement of the scribe piece is very realistic and obtainable, that I think a lot of people, wonder or have fear about.
Yeah. I mean, I normally run my clinic with one LPN. And I think the AI lets me do that because there's less administrative burden, again, for documentation. I can just hop from room to room, and, I'm taking care of the billing, like the injections, like the AI has helped me get all those things lined up so that when it's time to actually do an injection and then leave, like I can just tell her like, hey, I need an injection. And before I know it, like, the patient's already like on their way out, the note's already done, the injection's billed, like all the documentation is done, and she's already on to the next person. And so for me, I'm able to run really efficiently, seeing about 50 patients a day with just one assistant. And so I think there's some serious savings that can be had from that standpoint of just efficiency.
Yeah, that's awesome. I just keep thinking back to your quantifiable results that you called out, the trickle effect that individuals don't realize that you can't really calculate, or you don't calculate. That you're waiting for a peer-to-peer on hold for 45 minutes and walking into an exam room with a code word of a provider to the patient to sneak them out to get on the phone with that peer-to-peer, and then you drop the call, and the patient waiting at the front desk for their note to be finished so they could take a printed copy of it.
Right. Yeah.
Is the immediate impact in it going through a portal experience. So there's definitely a trickle effect of time efficiency for staff and patients, not just you as a provider.
Oh yeah,
I love
for
that
sure.
call out. Yeah. Well, Dr. Nord, it's been incredibly insightful. I really appreciate your valuable time and walking us through your impact and your efficiency and sharing your insights, and hopefully helping other providers here. If you just have that little bit of fear, to go ahead and take that jump over to change management and give it a try. But thanks for listening today and joining us. And so everyone out there, thank you for listening to our In Practice episode. Be sure to subscribe and catch us on our next episode. Thank you so much, Dr. Nord. We appreciate you.
You're very welcome. Thank you very much.